this is the history of how stem cells made it into America and became legal for patients to have access for patients to get stem cell trials. So these are my commercial disclosures, and none of them will have any impact on the content of my talk. In the 1990s, we were seeing huge promise with stem cells, but the problem was that the stem cells were all embryonic. And so the religious right in Texas and other places said, no embryos, no stem cells. So the US basically just got shut down completely while other countries were continuing with their things. So then the state of California said, okay, well, if there's a federal ban, then we're gonna do a state bond raise. So these two fabulous ladies, Jeannie Fontana and Melissa King, created the California Institute of Regenerative Medicine, CIRM. And you can go to CIRM even today, cirm.ca.gov. It's the California State Stem Cell Site for these different therapies. So CIRM raised $6 billion. Jeannie and Melissa had never done this before. And as soon as the religious right and the people found out that California raised this money in the state instead of federally, the federal government sued the state of California and locked up all the money in the courts. So it was just basically, we're just going nowhere fast. So then, while we're making no progress, everybody else is making tremendous progress, and we're falling way, way, way behind. So then, in 2012, these two geniuses, Dr. Yamanaka and Dr. Gurdon, showed that you could take adult stem cells, or partially differentiated stem cells, and deprogram them back to embryonic form. So we don't need embryos anymore. And so as soon as this discovery came out in 2012, we were like, we need to kind of let somebody know about this because we don't really need to work with embryos. So there's a lot of different parts of this story. There's a patient named Doug Oliver from Tennessee. Doug Oliver developed blindness and in both eyes from macular degeneration. And he lost his vision, he lost his driver's license, he lost his job, he lost his wife, and then he went to go see an ophthalmologist in Florida, a Harvard-trained ophthalmologist who injected bone marrow-derived stem cells directly into his orbits, and he got his vision back. It was just unbelievable. So these politicians said, well, I think we need to bring Doug Oliver to Congress. And we need to have him tell the story. So Dr. Bill Frist, and we're going to go into some details of who these people are, who's former Senate Majority Leader Bill Frist, and Senator Lamar Alexander, who was the head of the Senate Health Care Committee at the time, and Mitch McConnell. They went to the Senate docket, and they said, we're going to talk about stem cells, and we're going to bring Doug Oliver to Congress, and we're going to have Doug tell the story about how he got cured of blindness with stem cells injected. So obviously a very powerful story. So the patient told his story. So then in 2015, I went to a birthday party in Coconut Grove, and where I live in Florida. And kids are having fun in the pool, and parents are socializing, and I meet this guy named David. And David's like, oh, you're a doctor? I said, yeah. I said, what do you do, David? And he said, oh, I raise money for federal politicians. And I was like, oh, never heard of that kind of job before. You raise money for federal. So we start talking about stem cells. And he said, oh, yeah, there's some individuals who are going to be making stem cells available for patients in America. So people aren't going to have to leave America to go to other places to get their stem cell treatments. They're going to push the pharma lobby aside. We're going to work with the FDA, and we're going to get stem cells. They're going to bring this to Senate. It's going to be in the Senate docket, and they're going to bring this forward. So I said to David, David, listen, I'm a doctor. You're telling me that these individuals are going to push aside the pharma lobby and they're going to work with the FDA? I mean, I hope you're right, but I just can't imagine how these individuals could do that. And David said, okay, well, do you know Bernie Marcus? And I said, no. He said, oh, he's the founder of Home Depot, the Marcus Foundation. And then he said, do you know Ed Bossarge? And I said, no. And he said, oh, he's the founder of IBM. He's a PhD mathematician from Houston. And then he said, do you know Dr. Frist, Bill Frist? And I said, yes, of course, because my office is on the campus of an HCA hospital. I'm very familiar with Dr. Frist. He's done, you know, he would have made a great president, amazing person. So he said, well, I actually was on Dr. Frist's plane, and we went up to his house in Nashville, and then we basically went to Mitch McConnell. We went to the Senate docket, and we talked about stem cells. And what they did was, in the Senate docket, there's like one line for each topic. So Mitch McConnell takes out a big fat Sharpie and writes in all capital letters, stem cell, on the Senate docket for the U.S. Senate. So, okay, that's David. Okay, now we're going to wind the clock back a little further. 1997. I'm doing my residency at Thomas Jefferson in ENT, and I have a co-intern. She's doing her residency in urology. Now, I don't know if you've ever, if anyone's ever experienced a urology rotation before, but for a woman to do urology, you have to be able to make like a sailor blush, I mean, that's just the way it goes. And this colleague of mine, Dr. Robin Smith, she could make a sailor blush. And she was tough. And we did our internship together. We took naps together. We got yelled at together. We went on coffee runs together. So then we finish our residencies. Robin Smith goes to Wharton to get an MBA, and I go to Baylor to do my plastic surgery. So we kind of like lose touch for a little bit. So then Robin Smith becomes the CEO of a company called Neostem. And Neostem is a giant global pharma company. They make, their customers are big pharma to make cell therapy products. So they already had an existing relationship with the Vatican Science Panel. Now Robin is the CEO of Neostem, and she says, I don't want to just talk to the Science Panel, I want to talk to the Pope. Okay, now Robin's, she doesn't mess around. So Robin Smith, she, like I said, she went to Wharton, CEO of Neostem, Vatican Science Panel, personal friend of Pope Benedict, personal friend of Pope Francis, and she's on Good Morning America. She writes articles for stem cells for the Wall Street Journal. She's just an unbelievable lady. So Robin is now working directly with the Vatican, and she has a very big interest in stem cells, of course. So this is Robin, and this is the inside of the Vatican. This is not in the square. This is inside the gates, okay? And this is Robin with Pope Benedict, and then this is Robin with Pope Francis. And I said, who's this guy right here? I think I did my training with him, and she said, yeah, he was at Jefferson when we were there. And I said, why is he there at the Vatican? And Robin said, because he's married to Joe Biden's daughter. And there's Joe Biden and Hunter Biden, and there's Robin, and this other doctor. So they basically went to the Vatican in 2016, and this, I think, is a really cool picture because the light reflection above the cardinal's head, it looks like almost like a halo. It's like it's a great shot, And these are all pictures that were sent to me by Robin from her professional photographer from the Vatican. Robin said, if you're going to give these talks, you better tell people about my book. I said, I promise, Robin. So Robin recently wrote a book called The Healing Cell. And the preface of the book, the introduction of the book, is written by Pope Benedict. Now, I don't know how many people, can accomplish that, but she's a pretty special lady to be able to do that. So this guy, the guy in the purple, his name is Ed Bossarge, and Ed Bossarge is the founder of IBM. And Ed Bossarge travels with this big posse And one time I asked Ed Bosarge, I said, can I have your business card? And he goes, the guy in the third row on the right side in the back, he's my card guy. I go, okay, I'll go to your card guy and I want to get your card. So Ed Bosarge, who's a PhD mathematician and doesn't really know anything about stem cells or science, says, I knew in 2012 that we didn't need embryos. This is Ed Bosarge speaking. And he says, I knew that we only needed to do one thing to erase all of the religious and ethical objection in the whole world, just one simple maneuver. We just have to get the blessing from the Pope. This is what Ed Bosarge, this is what he said. And then he said like this, he goes, and I knew this Jewish girl, she said she could make that happen. And I knew that was Robin. So now this guy in the middle, that's Dr. Frist, okay? Former Senate Majority Leader, heart transplant surgeon, founder of HCA, just designated the wealthiest family in healthcare at $250 billion, based in Nashville. So Dr. Frist is a major stem cell guy, major. He actually wrote articles to say, when we were doing heart transplants, nobody thought it would work, and it does work. And now they're having the same skepticism about stem cells. And he said, why couldn't we just, grow hearts from stem cells in the lab, because we're having such organ shortages and compatibility issues? And then he said, which just blew me away in 2017 as a heart surgeon, he goes, or rebuild someone's knee with their fat. I'm like, I can't believe Dr. Frist knew fat in 2017 as a heart surgeon. That's like really, really impressive. This guy with the gray hair is Tommy Thompson. I'm like, I have to ask Robin who all these people are. I'm like, Robin, who's the guy with the gray hair? He's Tommy Thompson. He's the U.S. Secretary for Health and Human Services, and he was there with the crew when they went to the Vatican. So the Vatican, the visit was for two goals, and this was all orchestrated by Dr. Frist and by Ed Bosarge and the crew. One was to get the Pope's blessing for adult stem cells. The other was to get the Pope's blessing for the 21st Century Cures Act. Now, I had no idea what that is, and I'm now reading through it. The 21st Century Cures Act allows us to treat patients with stem cells in America and do single patient INDs and do all these different things. So Dr. Frist said, before I take this to Congress for the 21st Century Cures Act, I'd like to say the Pope thinks it's good. So what do you guys think? So they got the Pope's blessing for both. So this is Dr. Frist saying hello to the Pope, and this is the second part of the handshake where he goes for the two-handed handshake, and then this is where he's asking for the blessing for adult stem cells and for the 21st Century Cures Act, and that was in 2016. So this is the Vatican Science Panel, and these are all like regulatory directors from all over the world. And you can see Dr. Frist is very engaged. Look at his passion. So he is basically presenting and kind of leading the pack and saying, we need to be able to use adult stem cells in America. Can we get your blessing on that? And the Pope said, yes. And when you look at Dr. Frist, I'm like, who else is engaged like he is in this conversation? There's really nobody else. And I love this picture where he's like, look, I know it's nice to meet the Pope and everything, but like we got some work to do here. So like, let's get down to it. So this is like Dr. Frist, he's my hero. So Pope gave the blessing for adult stem cells, gave the blessing for the 21st Century Cures Act. That was in 2016. So remember, this is only 2024 right now. So this is relatively recent history. So then the Vatican starts to have their own stem cell conferences for adult stem cells, and this has been something that is really powerful. So if I go to lecture at a Catholic hospital and they say, you can't talk about stem cells, I just send them this slide. And I go, oh, well, I just want to show you a few things here about why I think we could talk about adult stem cells. So this is Dr. Frist. And I was lucky enough to meet with him in his office in Nashville several times. And the two things that are the biggest things about the 21st Century Cures Act are the RMAT designations and single patient INDs. So RMAT designation means that we're using stem cells to treat a particular disease. If that's a regenerative medicine accelerated therapy, we can do that trial in 5 years instead of in 10 or 15 years. So it dramatically reduces the time for approval. And then the single patient INDs were, so if a patient needs stem cells for a particular ailment, that they can get the stem cells and they don't have to get a placebo, and they can get a single patient IND where the FDA is the treating physician. So they accomplished this. So then then the religious right says, okay, the Pope says it's good, adult stem cells, great. Boom, the floodgates opened, CIRM releases all their funds, and CIRM has funded over 50 different clinical trials with stem cells just in the state of California within the last 10 years. So CIRM is amazing, and now the US is actually back to leading the pack when it comes to stem cells and regenerative medicine. So Dr. Frist is an amazing person, and he understands the importance of regenerative medicine, but he's at a level that's a different level. You know, he's up here, I say, helping us from above so that we can do our job in the trenches to take care of these patients. So then the World Stem Cell Summit happens in 2017, okay? So this is 2016, they get back from the Vatican, they go World Stem Cell Summit, 2017. God bless Arnie Kaplan's, since passed away, but this is was a great person and always involved in the World Stem Cell Summit. This is Billy Davis. He's a former NFL Dallas Cowboys Super Bowl champion, talking about head injuries and working with the military and using stem cells for all these different head trauma type things. And then, of course, this is Bernie Siegel. And Bernie Siegel's the guy who put the World Stem Cell Summit together. He's the one who kind of got everybody over to the Vatican with Robin, and Bernie's a special guy as well, very special. So then, in 2017, we're ready to go, and then in 2019, after the passing of the 21st Century Cures Act, COVID happens, okay? So this is 2 years later. So at the University of Miami, we have some of the most amazing stem cell scientists, manufacturers, and doctors and clinicians. So they already were set up to start doing clinical treatments with exosomes and stem cells. And so patients were getting shipped in to the University of Miami from all over the country to get a variety of different stem cell therapies, whether it was Wharton's jelly exosome, bone marrow-derived stem cells, bone marrow-derived exosomes, adipose stem cells. And the amazing thing was that these patients who were dying of COVID and having adult respiratory distress syndrome, ARDS, for which there is no cure, all of their scar tissue in the lungs was going away, and they were getting extubated and going home. And I'm talking to my friends in the ICU, I'm like, I can't believe this. This is absolutely one patient after the next, and it didn't even matter really what the source of the exosome or stem cells were. They were all the patients were doing great. So the exosome stem cell INDs, just so you know, at the University of Miami, they're all allogeneic, okay? They're all from other unrelated individuals. These are all expanded cells that have been maximally manipulated and have been manufactured as a drug, and they have been cryopreserved so that they can be used in the future for different things. So Josh Hare, who's the head of the Interdisciplinary Stem Cell Institute, told me, he said, Randy, I had 400 batches of expanded bone marrow stem cells ready for other clinical trials, but all these patients are dying of COVID lung disease, so we're going to repurpose all 400 of those batches, and we're going to start treating patients all over the place with these cryopreserved bone marrow-derived stem cells and getting great, great results. And the route of administration is IV, okay? So these are drugs. These are things that are administered into the intravascular space, and this is serious stuff. This is just an example of a stem cell treatment that was done in Abu Dhabi, where they used a stem cell nebulizer with patients who had COVID ARDS, and you don't have to be a radiologist to see the improvement in the chest x-rays. This is just from a nebulizer treatment down the endotracheal tube. So, look at the progression here from end-stage lung disease and scar and fibrosis to no scar and healthy lung tissue. That's unheard of. That's like not documented in any medical book anywhere. So regenerative medicine, has shown great progress, and we know the what. Like, we know what happened. We know we gave the patient exosomes, the patient did better, the patient got rid of his disease, got extubated, went home, but we don't know how, and we don't know why. So we're really working on backwards to a certain extent. We're helping the patients, and at the same time, we're trying to figure out the science, because we really don't have any idea what the actual science is. The results are very encouraging, and I would tell you that all of these trials that are being done in the United States right now, there's not one adverse incident or one complication that has been reported with any of these stem cell therapies anywhere in the country. So the FDA, who did not even know how to spell the word exosome 5 years ago, that's pretty amazing for the FDA to get moving so quickly, is now seeing that we're curing diseases that are incurable and that patients are getting better and they're going home, and the bottom line is that they're not having any complications, they're not having any problems. And we don't know what kind of drug study can you do where there's no complications at all, like with none. So Dr. Marks, Peter Marks from the FDA, is on speed dial with these guys on their cell phones, because he knows that they can get stem cells to really sick patients, and that the patients can have a chance to really, they could save their lives. So it's a very interesting thing. So excellent safety profile, and that has been really, huge with the FDA. And of course now we can say we have no religious or ethical objections anywhere in the world. We can collaborate with anyone. We're using adult stem cells. If we have to deprogram them to iPS cells or pluripotent stem cells, which are embryonic form, we can do that in the lab. We don't need to go get that from an embryo. So now we are in a totally different situation than we were 10 years ago, because of people like Dr. Frist and people like Bernie Siegel and people like Robin Smith, who have all worked together to help us with this initiative. Now, this is from the pharma side. We're doing this from the point of care side, and soon, we'll connect in the middle. But I think it's important for us to know, as clinicians working with patients in the trenches, that there are these trials out there, and we can get patients into these trials, and we can cure some things that were considered to be incurable in the past. So, and then it's very important also, interspecialty collaboration. We all need to work together. We need to work with the scientists, we need to work with the specialists, and the whole team to run these clinical trials. These are, each clinical trial is $1 billion initiatives. So they have to really work together and be cohesive and get these things going. And it's been a tremendous, tremendous success. And there is no doctor that knows this story. Like, no one. And honestly, if I didn't know Robin and I didn't have that conversation with David, the fundraiser for the federal politicians, I wouldn't know this story either. So it's a kind of a unique opportunity for me, because I have seen it go from square one to the point where we're now really, really advanced. So just to give you an idea, Camillo Ricordi at we talked about this yesterday, at the Diabetes Research Institute, he's using islet cell transplants to cure diabetes, but the thing is that the immunosuppressant drugs kill the patients because those islet cells are so immunogenic. So now, instead of killing the patient with immunosuppressive drugs, Camillo is using his own umbilical cord exosome drug, and he is inducing immunotolerance and immunomodulation so that these patients can have their islet cell transplants, have no immunosuppressive medications whatsoever, and they now have 2 patients in Miami that are off of their insulin completely. So I mean, imagine if you could cure diabetes, with this kind of a thing. So again, these are not plastic surgeons, these are not dermatologists, this is a whole different level and a whole different ecosystem, but it's just great that we have this relationship with them and that we have them kind of looking over us and hovering over us from above, and if we have an issue, we know who to call. And just to give you an example of other cases, so Josh Hare is the director of the Interdisciplinary Stem Cell Institute at the University of Miami, and he does clinical trials where he injects stem cells into the heart for congestive heart failure, and he's gotten great results. So we had a colleague who was dying of COVID, unfortunately. And he was on ECMO, he was on the ventilator, and I called Josh and I said, Josh, can we get this guy some stem cells? And then I looked on the PubMed and it said, oh, you can't give blood products to people on ECMO because it messes up the oxygenator and then they don't get their... And then I said, I'm sorry, Josh, I should have done my homework before I called you and looked like an ass. And he said, oh, no, we do it differently. And I said, well, what do you mean? He goes, we just squirt the stem cells right into the pulmonary artery. We don't even go through the oxygenator. And I said, well, how do you do that? And he said, the nurse does it in the ICU through the Swan-Ganz catheter. So these are treatments that are being done at the bedside. And, so it's an incredible thing with really no morbidity, huge amount of upside. And I think it's going to be our job to kind of take this information to the public. The public is pushing, and I think there's a real need and there's a real desire for stem cell therapy, but there's a lot of pieces to this puzzle that people just don't understand. And we need support from the legislature, we need funding for these research projects, we need the Pope to continue to give his blessings, et cetera. So that's really the story of how stem cells became legal in America to be able to treat patients in America with stem cells for these different clinical indications. So I hope this was it's a true story. I mean, I guess you could tell from the pictures, it's definitely a true story. And it's a delight to be able to bring this to you. And I would like to thank Team Tulip, because they were nice enough to add this on at the last minute, because I said I would love to be able to give this talk. So thank you for the opportunity, and I hope this was informative for everybody. Thank you.
If you're looking for in-depth training in regenerative medicine, join the SDARTS online learning library, a membership-based resource offering exclusive courses and hands-on procedure videos. Gain anytime, anywhere access to cutting-edge education designed to elevate your practice. Use the promo code YouTube to save $100 on your first year's membership. Click the link in the description to explore membership options. If you found this video valuable, be sure to like, subscribe, and hit the notification bell for more expert insights.